What's up, guys? It's Dominique, aka, and then this always with this screen. I don't know. I'm always, aka that therapist. For those of you that don't know me, I am the lead clinician and CEO for a group practice known as Yellow Bird Counseling. What does that mean? Well, it means a couple different things. First of all, what we do is we provide individual, couples, family, and group therapies and counseling, because there's a difference. We provide therapy and counseling. Therapy, in short, is for people that may be dealing with the mental diagnosis, and counseling is for people that may not be dealing with a mental diagnosis, but just need some guidance. So kind of like life coaching that your insurance can pay for, but from a licensed professional. So there's that extra added security there, and knowing that you're getting proper information. Okay. And that's in real short. I have a video on the website if you want to go to yellowbirdcounseling.com. Again, that's yellowbirdcounseling.com, and look under the blog section. There's a whole entire hour-long live of the difference between therapy and counseling. Okay, so you can take a look at that. And we provide it in the states of Alabama, Louisiana, Mississippi, and soon to come New Jersey and Georgia. Okay, so we do provide therapy in those states, and we do offer in person and virtual in Alabama. Okay, so that's a little bit about what we do outside of here. But what do we do in here? Well, every week we educate the general populations on reasons that we could all benefit from therapy outside of simply just having a mental illness. Part of what contributes to the stigma is that something has to be quote unquote wrong with you in order for you to have a therapist. Not true. You can use therapy a lot of times proactively as opposed to interactively, but a lot of times people wait until they get to crisis intervention until they utilize therapy, which if you use it proactively, your life can go a lot smoother and you can catch issues a lot quicker than if you wait until you're in crisis mode. So we educate the general population on different topics. Actually, this is the first topic in a long time that I've done directly related to a specific diagnosis, because again, all of us don't have a mental diagnosis. All right. And so you might think, oh, well, this won't be helpful for me. No, that's why we do other topics. So we've done things like social media addiction. We've done things like text message anxiety. We've done things where we have paralleled what celebrities might be going through to our lives. We have done toxic masculinity. We have done, think of some things that aren't necessarily related to mental diagnosis. We broke down what toxic means. We talked about trauma, which can lead to a mental diagnosis, but doesn't always have to. Sometimes trauma is, just that in and of itself, trauma, but not necessarily, the product is not necessarily a mental diagnosis. So there's that. There's several. If you want to go to our video section, or again, like I said, even just educating you on what therapy is, what counseling is, how that can, creating boundaries. We talked about that a lot. We've talked about gaslighting a lot. We've talked about how to prepare, dealing with grief. Grief is not a mental diagnosis, but something anybody can experience, whether that's grief of a person, grief of a situation, grief of a job, grief of a stage of life. We talked about grief. So those things, again, those are just to name a few of things that we've talked about that are not directly related to something's wrong with you, you need help. Okay. Even though there's nothing wrong with being something wrong with you, the general stigma around something being wrong with you puts people off to therapy that may actually need it. And not because something's wrong with them, but because they're human. And as long as you're human and you think thoughts and you live in a world that you can't control, then the likelihood that you need therapy is definitely there, because everything doesn't always go our way, and that can affect us. And if we're not sure how to deal with that, then that can cause us distress, and any human can go through. You don't have to have a mental illness to be in distress. Okay. That's just what we do here on social media. Generally, we just break in the stigma that surrounds mental health and mental illness and mental wellness. But today, I got to prepare us, okay? I got to prepare us because sad season is upon us, all right? And I have to be very aware of sad season because things start to get, I'm going to even have a group supervision with all my therapists and interns this weekend on how we can strategically prepare for sad season. Because what happens is clients that, could have been doing well for months, start feeling the that comes along with the days being shorter and the dark and longer. Okay. And so SAD is, or more distinctly known as seasonal affective disorder, which is categorized as a type of depression that you only experience seasonally. So it lasts for about 6 months. So 40 to 50% of the year, which is a long time, usually starting around November, late October, early November, and last until about late February, early March. Okay. So because of that, I want to start talking about depression. Also, too, for Suicide Prevention Month, I want us to talk about disorders that could contribute to suicidal ideation. So depression is the one that people are most familiar with the symptom of suicidal ideation. So there's a couple reasons that I'm doing this overview today, but definitely this is just going to be an overview. This is not going to be as detailed as the videos related that I've done related to depression that goes into more detail each type of depression. So definitely look back at that. Look at our video archives on our Facebook page. You'll have to scroll through those videos. You just click on the video tab at the top of our Facebook page, and you can scroll and see all the videos that we've done over the past 3.5 years now. Oh my God. Yellowbird Counseling went public April of 2019. So that's, 19, 20, 20. Yeah, so like almost 3.5 years. Okay, so you can scroll through all the videos and see what we've done. I'm trying to think of what was the very first video that I did. I think it was petty. Like, I think I did my first live on breaking down petty and what does that actually mean. So you can go back and look at that if you want and kind of see the evolution of the videos over time if you like. But there is that. So what I'm going to do is just talk about different types of depression, because again, when we say depression now, that's like an umbrella term for things that go under it. So we have bipolar disorder, major depressive disorder, premenstrual dysphoric disorder, seasonal affective disorder, what's the other one? I bought out my trusty DSM-5 to make sure I kept it at an overview and to keep me like going and not going down rabbit holes. But so if y'all want to see, this is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Okay, 5th edition. That's important. I have the 5th edition and the DSM-4 revised editions, but this is our Bible for mental diagnosis. So with this, I'm able to make sure that I don't miss any types of depression in our overview. So the very first one on the very first page of the section of depressive disorders is bipolar and related disorders due to other medical conditions. So sometimes mental mental illnesses or mental disorders, whatever feels most comfortable for you to say, can be medication induced or substance induced. So that's what that means when we see medication or substance induced. But in general, because this is an overview, bipolar disorder is a type of depression that has two moods associated with it. Okay. So we have the depressive mood, and then we have the manic mood. So in the old days, or back in the day, bipolar disorder was also referred to as manic depressive disorder. Within bipolar disorder, there's, I think, 4 or 5 different types. Well, besides the unspecified types. But we have rapid cycling, we have bipolar 1, we have bipolar 2, and then let's see, which bipolar disorder in this new DSM is not actually classified under depressive disorders, but because it is popular and people be misusing the word, I thought that I should include this. Okay. So when somebody has mood swings, that does not necessarily mean that they have bipolar disorder. Bipolar disorder, again, is signified by a depressive mood and a manic mood. So there's 2 types. We have hypomanic and we have hypermanic, okay? So that would be with the bipolar 1, we have the hypermanic, where that's going to look like more of your, I'm on top of the world, I can do anything, I take on all these tasks and I can complete them and I feel really good and everything's going great and I just, don't need any sleep. And even if I don't have any sleep, I'm not tired, I'm energized. Then we have the hypomanic or bipolar 2, where maybe you are, maybe not as much grandiose sense of self or anything like that, but you are, not needing as much sleep. So one is just a little bit more severe than the other. And the timing, how long the manic and depressive episodes a little between. Okay, but that is signified. What I want y'all to remember in the population is just because somebody has mood fluctuation, that does not mean that they have bipolar disorder, okay? They can have mood fluctuation for different reasons, okay? Bipolar disorder just simply means you switch between having a depressed mood and a manic episode, okay? And how rapid those happen and how long they last and how severe they are determines which type of bipolar disorder that you are experiencing, okay? That's what you need to know for the overview. So stop going around saying, you must be bipolar. Don't say that because you don't know. And it's a very serious diagnosis. My clients that deal with bipolar disorder, it's very serious. So you can't just go around just saying that, just making it something that, like, because it almost sounds like the person can control it when you say it like that. So again, be careful with the terms you're throwing around because you could be misusing them and it can be harmful to misuse terms, okay? And again, ask me any questions you have as I'm going through this overview, all right? But in general, with depression, things that you want to look for, is there a change in your interest or pleasure in doing things? Like, do you have a lack of interest or pleasure in doing the things that you normally would enjoy doing? Feelings of worthlessness or hopelessness? Are you more irritable than normal? Are you noticeably irritable over a long period of time? Are you eating more? Are you eating less? Are you sleeping more? Are you sleeping less? Okay. Is there difficulty with your concentration? Are you easily agitated? Or are you having suicidal ideation? So with suicidal ideation, ideations are just really just a fancy way of saying thoughts, okay? So are you having thoughts of suicide? So ending your own life. Or sometimes those ideations might not look like ending life. It could be like, well, if something happens to me that causes my life to end, I'll be okay. So you might not necessarily actively be planning to end your life, but sorry y'all know Star, she's just her voice carries, and so it threw me off. But sorry, threw my whole train of thought off. But basically, having the thought, it can even be fleeting, of like, okay, if I'm not here, then I would be okay with that. But really what people are saying with suicidal ideation is they want to end some type of pain, whether that be emotional, mental, physical, spiritual. In some area of their life or their psyche, there is pain that seems so unbearable that it just might be easier not to have to live through that. So to give you a more well-developed idea of what suicidal ideations look like. And sometimes clients come to me with suicidal ideations that they don't have to be hospitalized for it. Because I'm a trained professional, I know when that needs to happen, okay? And I was trained to know what that looks like and what needs to happen as far as safety planning and things like that. But just because, and this is a myth, just because you tell your therapist that you have thoughts of wanting to attempt suicide or self-harm, that does not necessarily mean that you're going to the hospital. That's why a lot of people don't come to therapy or tell their therapist if they're having those thoughts, because they automatically assume that means they're going to be having to be admitted to the hospital. Not always, okay? Not always. I have had several clients that have dealt with suicidal ideation that have not had to be hospitalized, okay? Ever, any. All right. So don't think that just because, I have thoughts of self-harm, or even like fleeting thoughts or thoughts that you don't want to act on, but they are there in your head. So let me finish my thought before I go on to the next one. That does not necessarily mean you'll be hospitalized. For myself personally, when I've done suicidal ideation, it more so looked like me envisioning a funeral and being okay with that. Did I have a plan to actually harm myself? No. Did I attempt to harm myself? No. Did I have a desire to attempt to harm myself? No. But I was becoming okay with and settled with the idea of my funeral, to planning my funeral. Okay. But no, I wasn't going to try to take my own life. But because it was the ideation of my own death, then, that's when I realized, okay, I'm having suicidal ideation. This is when and this has been since I've been a therapist. So yeah, let me just throw that out there. Doesn't necessarily mean that you have to be hospitalized every time, because the hospital can do more harm than good sometimes. And that's up to the therapist and mental health professionals to decide and weigh the risk factors and decide if there's other adequate, your therapist and your psychiatrist. If you have definitely your therapist. So don't feel like, if I tell them this, they're going to put me away. I've had people tell me a lot of things that others have felt like will put them in the hospital, but it hasn't. Like some pretty severe stuff been able to work through with therapy and in the privacy of therapy sessions. So that's one thing I wanted to throw out there while I was touching on depression. But that's definitely, and it can be varying degrees depending on how depression is, but it definitely, the likelihood of suicidal ideations happening or developing when you are dealing with depression is there. How likely, how soon, and how severe, that is individual by individual, but that is in general depression as a diagnosis, with one of the major symptoms being suicidal ideation. Okay, cool. So let's move on from bipolar disorder and suicidal ideation, talking more about different types of depression. So then we have disruptive mood dysregulation disorder. This is where you're seeing more what we might call angry outbursts, okay, or tantrums. And that can be verbal rage. It can be physical aggression towards people or property. But it's just really having temperamental outbursts, okay? And that happens what is the criteria for it? It has to have been present for 12 or more months, and lasting 3 or more consecutive months without all of the symptoms. Let's see. Basically lasting for 12 months for at least 3 consecutive months at a time. I'm not going to get into all the clinical with y'all because I don't want to bore y'all with that as far as the diagnostic criteria. But basically, in short, because this is an overview, disruptive mood dysregulation disorder is a type of depression that's more so signified by angry outbursts, okay? Major depressive disorder is the one that you might most be familiar with. And this is signified by dealing with a certain number of diagnostic criteria for depression over a period of at least 2 weeks. So lack of interest or pleasure in doing things, feelings of worthlessness, just self-loathing thoughts about yourself, irritability, lack of sleep, increased sleep, lack of eating, increased eating, suicidal ideation. So dealing with those different criteria, any combination of those criteria over a consecutive, consistent 2-week period, we may be looking at a major depressive episode, okay? Also, again, with that irritability, you want to look at angry outbursts because with children, pervasive mood developmental disorder, the depression more so looks like temper tantrums and outbursts. So don't think that just because your kid is having angry outbursts, that they just being bad, something could really be going on, okay? So that's major depressive disorder. And we would call that 2-week period an episode, okay? Or at least 2 weeks. I won't say it only lasts 2 weeks, but it, starts with at 2 weeks, we know it's probably a major depressive episode, okay? And we have persistent depressive disorder or dysthymia, okay? So with dysthymia, of course, you're still experiencing poor appetite, hypersomnia or insomnia, low energy. That's another symptom. If your energy is low, poor concentration, which I mentioned, feelings of illness, and with this depressive disorder, you have a depressed mood most of the day for more than for more days than not, as indicated either by subjective account, meaning meaning that you've noticed, or observation by others for at least 2 years for this one, okay? During that 2-year period, 1 year, or 1 year for children or adolescents, okay? This where there's a disturbance in Okay. Okay, so basically it's just saying that it's persistent over 2 years and that you haven't been without presence of symptoms in that 12-month or 24-month period, depending on your age. Okay, so that's persistent depressive disorder. So you can definitely go from a depressive episode to, if you're experiencing it for that time frame, persistent depressive disorder or dysthymia. Okay. Um, this one, premenstrual dysphoric disorder. I'm just doing that because premenstrual dysphoric disorder be kicking me and some of my clients in the booty butt. Okay, me and some of my women clients in the booty butt cheeks. It be kicking our butt every month. Mine is pretty regulated, but each month is different. To where the antidepressant that I take, I go up on it for that 5-day period that of my menses. Okay, basically that's a depressive disorder that shows up before, during, or after, sometime during when your flow starts of your cycle, because your cycle is actually the entire month, but the point in your cycle where flow happens is where we see premenstrual dysphoric disorder. And then some of my clients, they only take medication around that time, but for the most part, the ones that start taking it, they already are dealing with some level of depressive disorder outside of their cycle. For the most part, there are some that really only experience it around their cycle. So they just take it like how I take it daily, and then may increase on the dosage around the menses. So, but this, I want y'all to know what this is characterized by, because folks be calling it PMS, okay? And it ain't. But it is mood swings, feeling sadness or tearful, or increased sensitivity to rejection. Whew, let me tell you something about my premenstrual dysphoric disorder. Me, I be wanting to fight. I be wanting to fight people for no reason, and not just like people on the street, but like let somebody cross me, fight. And that ain't safe, especially for what I do. Can't be folks. So I went to my psychiatrist and I was like, I be willing to fight people. Like, it was. So I went to a brunch, a very popular brunch in the area, and I brought a coffee into the brunch. And the owner of the venue told me that it was okay this time, but then the security guard follows up and says, "You can't bring that in here." Man, I was ready to fight this man for doing his job. I was like, okay, you got to be self-aware. I'm like, that's not okay. And I had to leave. I'm like, no, I have to leave. I have to leave here because I am very, very upset. Wanting to lay hands on somebody. And so I had to leave, and that was the safest thing to do for probably me, because he probably could take me down. He was probably, twice my size and much more athletic, but it was rage. So usually around this time, like during your menses, if you're dealing with premenstrual dysphoric disorder, you get either really, really keyed up, so really, really anxious, very, very irritable. Anything can set you off. Like I just said, marked irritability or anger or increased interpersonal conflicts. So I always tell my partner, I'll be like, listen, my period's on, just so you know. I try to, do what I need to do to manage it, but just so you know. Depressed mood, feelings of hopelessness or deprecating thoughts, marked anxiety, tension and or feelings of being keyed up. I already said that. Decreased interest in usual activities, difficulty in concentration, lethargy, easily fatigued. I experience that every month, so I try to get my work, and I tell my clients how we structure their schedule around it so that they don't feel it doesn't feel worse to them that they're going to be less productive around this time. Change in appetite, overeating, or specific food cravings, hypersomnia or insomnia, a sense of being overwhelmed or out of control, physical symptoms such as breast tenderness or swelling, joint or muscle pain, and sensation of bloating or weight gain. Okay, so there you go. Overview of premenstrual dysphoric disorder. If you're noticing any of that around your cycle, definitely go and let your gynecologist know. Okay, and then to get with a therapist as well to help you manage it so you can better be prepared for those. Let me see. Y'all are typing a lot. Let's see. Hey, babe. Let's see. Hey, girl. I'm looking at y'all's comments. Been there. Nope. Room on TikTok live as a distraction. You're not late. You didn't miss nothing. I might be a mix of a few of these from time to time. All of us can be. Yep, during your cycle. Definitely, if you're in therapy, talk to your therapist about developing a plan around that so it doesn't feel so jarring. Yep, be crying for no reason, extremely sensitive. Been there, done that, and got the shirt to prove it. So yeah, definitely be sure that you are talking with your gynecologist and a therapist to help you manage that, because it can be like you're turning into a different, but it can feel like you're a different person. I'm telling you from personal account, okay? And from my clients who also with it that I help them manage their premenstrual dysphoric disorder, okay? So then we have substance or medication disorder. Whew, all right. For my herbal smokers, if you are dealing with the indica blend of a particular herb, you might start feeling low, and that is a downer. Okay, also 2 alcohols you might notice after drinking, you might feel more down or in your feelings. That is a thing to have substance or medication induced depressive disorder. You can have substance or medication induced depressive disorder with features of psychosis. So be very careful about what you're putting in your body. That's all I'm saying. Be careful, because you can have episodes of depression and not be somebody that simply because you put something in your body that your body said, I don't agree with that. Okay. A prominent and persistent disturbance in mood that predominates in the clinical picture and is characterized by depressive mood or marked diminished interest and pleasure in all or almost all activities. So yeah, there you go. And then, so that was our medication or substance-induced depressive disorder. And then you can have depressive disorder due to another medical condition. Okay, I think of a client I had when I worked in the psychiatric hospital that had brain trauma, which led to depressive disorder. Okay, but in general, And persistent period of depressed mood or diminished interest or pleasure in all or most all activities that predominates in the clinical picture. And the disturbance is not better explained by another mental disorder, like adjustment disorder with depressed mood, in which the stressor is a serious medical condition. Okay. So you can have different, some of my clients that deal with chronic pain, that can induce depressive disorder, or like I said, traumatic brain injury, TBI can be a disorder that can induce induce depressive mood. So I do definitely have clients get all organic aspects of their physical health checked out to make sure that the depressive disorder is not better explained by another medical condition. Even if it is, we'll still treat it. We can still treat it with therapy, but at least we know what the origin is better. Okay. And the origin is important. Cool. And please share this live again. Please share so your friends and family or someone on your timeline that may be dealing with some of these things and may not understand why. If you'll share this, and then that will be your contribution to breaking the stigma that surrounds mental health. So definitely do your part. It takes 2 seconds to click share on your timeline or in the groups you're in, so that this information can get out to people who need it and may have misnomers or stigmas around receiving mental health treatment. Okay. And then there's other specified depressive disorder, not otherwise specified, which just means you don't meet the criteria for full criteria. You might meet partial criteria for a specific depressive disorder. Okay. That's your crash course. What kind of questions do you have? I'm proud of myself. I didn't go off too many rabbit holes. That's why I have my trusty DSM to help me get through that. Well, what kind of questions do you have about depression or symptoms that could be depression? If you have any questions about that, I want to be sure to answer them. And again, please share this live. Please share this live so we can get this information out to people that I'm sure desperately need it. Okay, especially again with sad season approaching and people may be only experiencing these symptoms seasonally and they're not sure why. They may need help. What's up, Instagram? What y'all kind of question have? Oh no, not pause due to poor connection. Questions, comments. How can it be treated if it comes from another medical condition? That's a great question. So definitely in therapy, we'll deal with the symptoms, because even if it comes from another medical condition, you may need some other medical treatment in conjunction with the therapy, but still the lack of interest or pleasure in doing things, the hopelessness or helplessness, feelings, the concentration, it just depends on the severity. That can look different for everybody therapeutically, but we definitely would work probably more closely with your medical doctor as far as treatment is concerned. And that may be a medical doctor and a psychiatrist, also a medical doctor, but whatever, let's just say it's a traumatic brain injury. So that might look like your team might look like your neurologist, your therapist, and your psychiatrist all working on your treatment plan together. Okay. That's a great question though. Thanks for asking that. Okay, not like telling all this, but I had an open heart surgery last year and my anxiety and depression has been horrible. Okay, yeah. That's definitely something that you'll want to have a team, maybe your cardiologist, a therapist and a psychiatrist all working together on that with you, but definitely that would be a good start. Get yourself in contact with your cardiologist, a therapist, and a psychiatrist based on whatever your cardiologist is saying. But you may need some medication intervention with your treatment, but definitely talk to your healthcare providers about that possibility. And sometimes people have to take medication to help manage things that are as a result of medical induced depression. So and that's okay. That's fine. It's totally fine. Like literally, I take my depressive medication every day, and it's just one pill twice on my cycle, 2 pills once a day, or 1 pill once a day. So it's okay. It's just like you'll take it with your vitamins and everything else that you take. So it is that way sometimes. And it's okay. It's okay. You may not, like I said, you might just talk to your healthcare team and let them decide what you do and don't need. Okay? Definitely. What other that was a great question. Thanks for sharing that too. Because again, you're probably not the only person. There's probably other people. And if it's not the people in this live, they may have a loved one, or their loved one may have a loved one that they know that has, been experiencing depressive mood as a result of or after some sort of procedure, some sort of injury, some sort of something medical induced. Okay. Great question. What other questions do y'all have? Again, please share, so we can get the word out. And I'm looking over here too at Instagram to see what else. I'm scrolling through the comments again to be sure that I answer all your questions. What questions do you have either about depression, a type of depression, or symptoms of depression that I can answer for you? Or are y'all good? If y'all are good, that's good too. Then I'm going to be talking about borderline personality disorder, which sometimes people call that bipolar disorder, which you can deal with bipolar disorder and borderline personality disorder at the same time. I've seen it, and it is just so sad. I feel really bad for those people, because not only do you fluctuate between happy or extremely happy, like inflated happiness, sadness, you also fluctuate in love and hate, or idealization and devaluation, which also can cause some suicidal ideation as well. So we will talk more about that. But literally, you're pulled in 4, it's sad. I saw it a lot when I worked in the hospital, and it takes a few medications and regular intensive therapy to manage. So, yeah. Questions, comments, concerns, if y'all have any, that's great. Again, this was just an overview, and I chose depression because, it's a disorder that does have the paramount symptom of suicidal ideation. So I wanted to do that overview for that reason. Well, also, it's also domestic violence awareness. So we'll be talking about that as well. And then we'll be talking about how to support your loved ones who may be dealing with some sort of mental diagnosis. So we will be covering those topics. So definitely be sure you are here with us every Thursday of the month at 8 p.m. Central Standard Time. Sometimes I may be running behind if my last session comes, but I will be here at least by 8:30. Definitely check for me at 8, okay? And 2, if you have not already, you want to become a part of the text community. And you can, or if you're needing services, you can text the word new to this number here. Text the word new and we can get you set up. But also you'll know when we do our $100 Cash App giveaways. So you'll either know that if you're on the text community or if you are subscribed to our newsletter, you'll know it there too. To subscribe to the newsletter, you'll go to yellowbirdcounseling.com. You'll be prompted to subscribe there, and it's really not that big of a deal. I think you put your first and last name and your email address, and you're subscribed, and you're done. And you'll get our monthly newsletter, so you'll know about all the things we're doing and all the goodies. You'll just know all the practice-related stuff, discounts, events. You'll know all that. You'll be in the know, and you'll also know when we do our Cash App giveaways. Not today, though. The Cash App giveaway is not today. But a good try. It's not yet. It's not yet. It's going to seem random to everybody else, but if you're in the text community or if you are on the newsletter, you know exactly when the giveaways are and what to do in order to be eligible to win. Okay? All right. All righty, cool. Well, y'all seem like y'all good. So again, my name is Dominique, aka That Therapist. Please be sure to follow us on our Facebook, on our Instagram. I'm trying to do stuff on TikTok, but I'm telling you, my brain be so full. It's just and when I create content, I gotta be in a specific headspace. So I'm going to try to be over there more. But as of right now, check for us on Facebook and Instagram. Okay. Yellowbird Counseling on both of those platforms. And you have a great week too. And I will be back with y'all next week.